And a good day, everyone. We're cutting into your regularly scheduled programming because Governor John Bel Edwards just about ready to give his news conference updating not only on yesterday's storm damage in Monroe in northern Louisiana, but also his COVID-19 update as he's been doing most days throughout this pandemic. Here he is.
This press conference is going to serve as a briefing both on the severe weather that was experienced across North Louisiana yesterday and also my daily briefing on COVID-19. I want to thank all of the local officials who've joined us today. I know we have Mayor Jamie Mayo, Mayor Stacey Albritton Mitchell, other elected officials including Senators Katrina Jackson. I know we have Senator Jay Morris, Senator Stewart Cathy, also Representative Mike Eccles, and we also have Representative Jones, I think. We do, right there. Good to see you, Fred. Thank you. After I speak, you're going to hear from Congressman Ralph Abraham, and we also have here today with us, as I have been every day in Baton Rouge, Dr. Alex Bu from the Department of Health, and he can answer specific questions related to COVID-19 testing and other things related to the coronavirus. We just completed a tour of some of the tornado damage across North Louisiana. We did have 2 tornadoes confirmed here in Ouachita Parish. The main one was an EF2 that had wind speed up to 120 miles per hour. I do want to thank everyone for wearing a mask because it's critically important that you do that. And of course, I was doing that until just a moment ago before I came up to speak. And what you do is you're being a good neighbor when you do that, because you're really not so much protecting yourself, you're protecting your neighbors from you. And I appreciate that because we still have a ways to go with the COVID-19 public health emergency. Speaking of emergencies, yesterday we did issue an emergency declaration regarding the tornado damage across 5 parishes in North Louisiana. And no parish was damaged more than Ouachita Parish. It looks like there were 2 tornadoes with an approximate 2-mile storm track. So as we stand here right now, Ouachita Parish has 3 active emergencies going on. The high water emergency that's been in place, I think, since January, the COVID-19 emergency, and the tornado emergency. Search and rescue operations just were completed, and those were the secondary search and rescues. Primary search and rescues happened earlier. And I will tell you, when you see how significant the damage was, how widespread it was, the fact that they're reporting here in Ouachita Parish 3 minor injuries and no fatalities and no serious injuries is a miracle. And we should all be very thankful of the fact that not more people were injured or killed. The Vice President asked me this morning to relate to everyone that he and the President were certainly leaning forward to do whatever needed to be done here that they could help with, and keeping the people in their prayers. One of the things that has 2 emergencies playing off of one another is we know that the Black Bayou Pump Station in West Monroe took a direct hit from the tornado. It's been without power, and I know that the switches there were destroyed. So we don't know yet whether the pumps themselves were damaged, but we do know that they're inoperable and will be for some period of time. And of course, that's a problem because we have the high water emergency, and it wouldn't take much rain in the near future to cause some flooding problems. And those 3 60-inch pumps are the most important in all of West Monroe when it comes to making sure that we can control floods. So we will be working with the folks here in Ouachita Parish and in West Monroe to ascertain the damage, but we're going to try to make sure that we can do something about finding some other pumps to come up and supplement the pumping that would take place in West Monroe if there's going to be some rainfall. We have about 8,000 structures in Ouachita Parish without power right now. That's a significant number, and I know that some of the damage that took place because of the tornado damaged serious electrical infrastructure to the point where it's going to be a couple of days, I think, before most of that power will be restored. Need everybody to be patient and treat every downed wire as if it's live. Many times it's not the storm directly that injures or kills people, it's people who go out and work to cut trees and they're not mindful of the power lines and so forth. So everybody please be patient, treat every line as if it's charged. In addition to what happened here in Ouachita Parish, we had 2 confirmed tornadoes in DeSoto Parish, and damage assessments are currently under the way over there as well. And there were a number of individuals who lost their homes in DeSoto Parish. We're also assessing damage and possible tornadoes in Bienville, Bossier, Red River, and Webster parishes. I do want to thank all the local and state first responders and emergency officials who are helping with the recovery mission. Yesterday, the Louisiana National Guard delivered 1,026 tarps and 10 pallets of water. That's about 22,000 bottles, by the way, to the city of Monroe. The Governor's Office of Homeland Security and Emergency Preparedness prepared, and I signed a letter. They prepared a letter that got sent in for the Community Disaster Loan Program, which provides operational funding to help local governments that have incurred a significant loss in revenue due to a major disaster, and that could affect their ability to deliver essential municipal services. So we're trying to stand up that loan program. Most of the folks, or most of the municipalities, I should say, in Louisiana are familiar with it because we've had to do it in the past. We've also requested that Verizon provide more cell coverage in the impacted areas and sent a USR team to assist the recovery mission and submit a request for a sanitization machine. This morning, FEMA Administrator Pete Gaynor called and I spoke to him and told him we would be submitting requests for individual assistance and public assistance. And we also requested that preliminary damage assessments for all the homes be allowed to be done through photographs, so that we're not out there with COVID-19 having to physically inspect all these properties and interact with more people than is absolutely necessary. He was receptive to that idea, and I think we're going to be able to get that done. I can tell you that I was personally struck by just how much damage we saw today in Ouachita Parish, how widespread it was, and you know, these tornadoes have a mind of their own, because every time I go out and look at the damage, there'll be one home that's completely flattened, and next to it is a home that looks like it didn't get touched. But to see so much damage, again, without anybody being killed, we do have that to be thankful for. And I know that doesn't just happen either. People were mindful of the fact that there were severe weather warnings, and I think that they took seriously the alerts that they got on cell phones and so forth. So I do appreciate the people of Louisiana, particularly here in Ouachita Parish, for doing that. Now, with respect to COVID-19, we do have some new numbers to report for you. I will tell you, they do continue to be encouraging. Over the last week or so, we've been talking about how we were flattening the curve and our trajectory was really improving. That continues to be the case. Let's see, we reported over 4,000 new tests today, and it produced 421 new positive cases for the state. That brings us to a total of 21,000 and I think 16 cases statewide. Unfortunately, we added 44 new deaths. That's 840 statewide. And you remember just a few days ago, we were reporting 70 deaths. So even that number, even though as tragic as it is trending in the right direction for us. Hospitalizations and ventilators each went up, but not at an alarming growth. So we have 50 new individuals with COVID-19 in the hospitals across the state of Louisiana, and 3 ventilators were added to what was already in service with COVID-19. So even though there's more people there, the growth rate there was not particularly alarming and indicates that we're moving in the right direction. I will tell you that anecdotally and somewhat non-anecdotally, I've received reports that the people of Louisiana over the Easter weekend did not take social distancing as seriously as they should have, and as the stay-at-home order and the mitigation measures weren't practiced as they had been previous to that. And I'm encouraging everyone to get back to taking this very seriously. The reason we are trending in the right direction, the reason we have a slowing in the growth of cases and so forth, and deaths, is because of the social distancing, the hygiene practices, the stay-at-home order. And all it takes to have a spike in cases and go back the other direction is for too many people to violate the order, too much social contact to spread this disease. So I'm asking everyone to do better. And I can tell you that the Unicast social distancing dashboard, which tracks movement by cell phone GPS data, the state actually wasn't doing that well before. He had a C-, but we now have a D because there are too many people moving around. And so asking people to take that seriously. As we announced last week, we are seeing racial disparities in the outcomes with respect to deaths across the state of Louisiana. And it was, we had reported 70% of COVID-19 deaths were among African Americans, even though they made up 33% of the state's population. That was the right percentage, but that was the percentage of known, of the races of the individuals that were known. We've actually been able to update that a little bit. 60% of the deaths are among African Americans, 30% are white, 8.8% are unknown. And so some of those are going to be African Americans, some will not. But what we know is that the percentage of African Americans dying make up at least twice what their percentage in the population as a whole is. And what we learn with the task force that's going to study these racial disparities will benefit everyone. But we know that we have an obligation to figure out exactly what's taking place here and better communicate during this COVID-19 emergency, and then make sure that the task force pays dividends thereafter in improving upon those health disparities that we're seeing across the state of Louisiana. What we know, and this is true for everyone, if you have an underlying chronic health condition such as hypertension, diabetes, kidney disease, heart disease, and many others, then that makes you especially vulnerable to this particular virus, to this disease. And we know that generally speaking, African Americans have these chronic health conditions in a larger proportion than others here in Louisiana and around the country. Since we're here in Ouachita, I did want to speak for just a minute about Ouachita Parish. There are 384 cases here of COVID-19 as of noon today, and that's informed by 3,896 tests reported, and that includes state tests and private labs, and 5 deaths. The parish ranks 10th among parishes in the number of COVID-19 cases across the state. In Region 8, there are currently 7 testing sites. That consists of Union, Lincoln, Jackson, Caldwell, Franklin, Tensas, Madison, East Carroll, West Carroll, Morehouse, Ouachita, and Richland parishes. We have some good news in North Louisiana coming out of LSU Health Shreveport. They have opened the emerging viral threat called the EVT lab, which can process COVID-19 test results in 24 to 48 hours and has a high-end capacity of 1,500 tests per day. And the CLIA CMS CDC approved lab is receiving samples from all over the state, and may take some testing from out of the state once Louisiana's peak has occurred. This lab literally went from an idea to testing samples in less than 2 weeks, and it is now one of the highest capacity, largest throughput testing centers that we have in the state of Louisiana. LSU Health Shreveport researchers recently administered the first convalescent plasma therapy in Louisiana to a critically ill COVID-19 patient. And I think they're about the third state in the country to do that, or third facility, I should say, to do that in the country. This investigative therapy uses convalescent plasma from individuals who have recovered from COVID-19. It's possible that this plasma contains antibodies to COVID-19 and holds promise in being effective in treating those critically ill with the virus. LSU Health Shreveport was also the first site in Louisiana and the second in the U.S. to offer inhaled nitric oxide clinical trial, joining Harvard University and University of Alabama Birmingham in that regard. LSU Health Shreveport was awarded $175,000 by the Caddo Parish Commission and will begin COVID-19 testing in rural areas of North Louisiana this week. The testing will be accomplished by repurposing mobile vans previously used for cancer screenings. This morning on our weekly governor's call with the White House, the Vice President led the task force on that call, and he and his advisors on the task force talked about the need to get with me to continue to improve on reagent and swab so that we can support our testing all over the state, because nobody wants to be in the dark. And testing, the more testing you have, the more you know about what's going on in the state as a whole, but in particular regions of the state. We know that there will be some additional news coming out this week about serology testing, which is antibody testing, which I think will be really important for us to have available when we start talking about relaxing restrictions, reopening the economy, and so forth, because it will measure who has antibodies in their system, meaning that they had COVID-19. And we know that's significant because a lot of people are going to know they had it because they had a positive test result. But there are a lot of people out there, some significant percentage of the population, who will have COVID-19 and not know it. But because they had it, they will have the antibodies, and it'll be easier for them to go back to work and to re-engage sooner than it will be for other people. Dealing with devastating storm damage on top of a public health emergency is very, very difficult. And I want to thank all of the first responders again who have done a tremendous job of managing the response to the tornado, managing the public health emergency as well. And I continue to be very appreciative of all the doctors and nurses, respiratory therapists, and other healthcare professionals all across the state of Louisiana who are doing just tremendous, tremendous work. And I will assure you we are going to get through this, but we do need people to be vigilant. And I'm just going to hit on this one more time today before I leave. I'm encouraging people all across the state of Louisiana and here in northeast Louisiana to be patient, to be mindful of the stay-at-home order, to be mindful of social distancing, wearing a mask when you're out in public. And just because the grocery store is left open doesn't mean you need to go every day. Go once a week. And when you go, you don't need to bring everyone in your family. And make sure you continue to practice social distancing so that you wash your hands more frequently with soap and water, that you use hand sanitizer when you can't get to soap and water, that you control your cough, that you stay home when you are sick. All of those things that we've been talking about remain very important to help us get through this. A little bit on unemployment. We know that as of today, more than $89 million in benefits have been paid out across the state of Louisiana. That includes more than $21 million in state funds. And then the federal pandemic unemployment compensation that pays that enhanced benefit of $600 per individual per week. That amount comes to more than $66 million in the state of Louisiana. And I do want to encourage people that who are eligible for the federal benefits, gig workers, 1099 workers, self-employed. You may have applied previously and you were told that you were not eligible for state benefits, but you may in fact be eligible for this enhanced benefit. So we need you to continue to pursue those and make sure that you do recertify every week as well. So with that, I'm going to turn over the podium to Congressman Abraham, who will make some remarks. But as he's coming up, he is a doctor. He understands this stuff better than I do. I do want to say that Louisiana is gaining 124 new medical professionals today. 124 graduates from the LSU Health Science Center Shreveport will be graduating early today, and so they're going to be able to help support the surge across Louisiana. And some of them will actually leave the state, but we're especially proud of the majority of them who are going to be staying here in their state. Unfortunately, they can't get together because of social distancing, and they're going to receive their diplomas electronically today. And they can begin their careers as early as May the 1st due to expedited licensing that's going to take place. We've got 57 out of 124 LSU Health Science Center Shreveport School of Medicine seniors. They matched in Louisiana. Of those, 51 matched to LSU Health residency programs in New Orleans and Shreveport, with 34 matched to Shreveport specifically. So all of these people are going to get online and help us with this public health emergency, and I really appreciate them for doing that, and I appreciate the licensing board for expediting the licensing, just as the Health Science Center expedited their graduation. So I'm going to ask the congressman to come up, and when he gets finished, we'll take your question. Remember, we do have Dr. Bu here who can help answer your questions as well.
Thank you, Governor, and I would just want to thank you, Governor Edwards, for your quick response force. Literally, as soon as the tornado left the ground, the governor was sending supplies up this way. He and I had a conversation yesterday. Also, thanks to President Trump, Vice President Pence. We've been in contact with them yesterday and today. They stand ready to go at a moment's notice. I'm just going to simply echo what the governor has said. I'm looking out at the crowd here. Our National Guard, state police, local police, fire, EMT, nurses, physicians, the first responders, you bring calm to chaos, to the uncertainty. When people see that you are doing your jobs, they appreciate it and know that you're in their prayers, you're in their hearts, and you are really, really in their minds right now, because when they see you in the community, again, this is a calm that they need and they look forward to on a daily basis. We've been through tough times before in Louisiana. We'll be through them again. But Louisianans have always relied on hope, faith, and hard work. We will continue to do that. We will get through this as we've got through other disasters, and this too, as we say, shall pass. So, Governor, thank you for what you're doing. We want to thank the President Trump's administration for what they're doing, and as important, and maybe more importantly, thank you for what you're doing. Thank you, Governor.
Thank you, Congressman. Look, the partnerships are working. The communication is working. Congressman and I had a phone call yesterday. This morning, I was on the phone with both the Vice President and a separate call with Administrator Gaynor from FEMA. And yesterday had very quick communications from Mayor Jamie Mayo. So it's local, it's state, it's federal, and it's all working. That's not to say it's perfect. But I can tell you people are working extremely hard to bring the relief to the folks here in Washington and across Louisiana with respect to the tornadoes and with respect to COVID-19. With that, I'll take a few questions, if you have them. Yes, sir.
Governor, were you able to speak to any residents here in the rural or in the parish about home for damage and what they tell you?
I did not. I did not. And it was a purposeful decision on my part, and it had to do with the COVID-19 emergency. And even though I had a mask on, I come from a different part of the state, and I was trying to make sure that we didn't have too much interaction. And it's always a delicate balance, because I saw people who were out cleaning up and working hard already to get past the tornado damage, and I saw some people in some homes that were obviously not going to be habitable tonight or anytime soon, but chose not to stop and talk to them because of the COVID-19 public health emergency. And that's, again, a very tough decision on my part, because this is the first time I've shown up, and we've had plenty of natural disasters since I've been governor, but this is the first time that I did not interact with folks who had sustained damage to their properties. Yes, sir.
Just a brief follow-up. Could you speak more about the complication of responding to a weather crisis on top of a public health emergency?
Yeah, so the question has to do with the difficulty of compounding the emergencies all at once. And I guess we're really going to see that if we get some rain here in the near future, right? And then the absence of those 360-inch pumps at Black Bayou will really come into play. So it becomes hard. So yesterday, it's not good news, but it was helpful that we knew 48 hours in advance of the chance of very severe weather. And so we were actually leaning forward. But as we're talking about getting tarps and getting water to the Ouachita Parish, we're also thinking about PPE for people who are going to be handing out the tarps and handing out the water and trying to make sure that you could do things and maintain social distancing and the hygiene practices that we need to have so that we don't inadvertently have more people catching the disease and presenting to the hospital than we need to have. And so it just makes everything much harder. But the good news here is that we did not have serious injury or fatalities. And you know, I think at last count, for example, next door in Mississippi, which was the same weather system, right after it left Louisiana, it started having its impact there. Last I heard, they had 11 fatalities, and the governor there, Tate Reeves, indicated this morning he thought when they finished their search and rescue there, they would have more than 11. So we do have a lot to be thankful for. We need to keep those folks in our prayers as well. Any other questions here? Yes, sir.
So many of the storm victims lost their jobs. Now they've also lost their homes. What kind of help can they look forward to from the state?
Yeah, well, first of all, they need to know we not just declared a public health emergency for COVID-19. We declared yesterday an emergency related to the tornadoes. This morning I was on the phone with FEMA letting them know that we will be requesting individual assistance, which most of the people are familiar with because of the number of times we've had to do this. Public assistance, and we're moving as quickly as we can. But you know, as to whether those things become available, it turns on how much damage there is, and so we have to get the preliminary damage assessments done. And we also talked to FEMA today about being able to do those damage assessments virtually so that we can look at photographs of a particular structure and not have to send people into that structure because of the COVID-19. So this is a little bit unique. This is a little bit different than we've ever done it before. I can only tell you that we've got FEMA's full attention of this. I've had a conversation with the Region 6 administrator today, Tony Robinson, with Pete Gaynor, who is the federal administrator working out of Washington, and I believe we're going to be able to bring assistance to people pretty quickly. One of the things that I'm most worried about is you would typically have a congregate shelter set up so that everybody who lost their homes and didn't have a relative or a friend who could take them in would typically go to a school gymnasium or something like that we'd set up a shelter. Well, with the COVID-19 public health emergency, that is not the most appropriate way to shelter people. So we're trying to get people into hotel rooms as quickly as possible, and the Red Cross has actually been helping with this as well. But this is something that we can do as well through Category B protective measures that we have in place because of the declaration that we've gotten from the federal government on COVID-19. So we're working with FEMA on that, and we look that some of these people are going to need a place to stay for quite some time because while many of the people were renters, it isn't like they have a lot of rental stock here that they can just move into. So we have no shortage of things to do, and I just want to assure people we're moving as quickly as we can because we understand the challenges that this presents to everyone. Any other questions? Yes, sir.
Governor, the President has indicated plans to loosen or lift social distancing measures by April 30th. If those federal guidelines were relaxed, would you follow suit here in Louisiana?
Well, it's just too early to know. And look, he's talking about sometime after April the 30th. Don't know exactly what timeline that looks like. And he's also indicated that what he does may not be uniformly implemented in all states at the same time because you have some states that are obviously more impacted than others. You just look at the case counts, and I know they typically are referred to as hotspots. Well, Louisiana is known as one of those hotspots. So that we're going to continue to work with him, with the White House task force, and I know that tomorrow he's announcing a council that is going to be advising him, and it's going to be comprised of doctors and scientists as well as business people as to how to open the country back up. As Dr. Fauci said last week, it's not like flipping a light switch where you just go from being dark to light all at one time. So this is going to be done in some sort of a transition, and we're going to be doing it that way here in Louisiana. I cannot tell you exactly what that's going to look like yet, but we will be working really hard with all the experts to get that figured out. And when we have something to announce on that, we will. We will be announcing later this week an economic resiliency recovery task force that we're going to stand up here in Louisiana that will advise me and local officials as well. Senator?
I have a question from one of the pastors that was watching live, and their question is this one, First Lady Robin. She says that they're experiencing some policy elderly who live alone but believe they may be sick. How do they get them tested without exposing themselves? Because most of those people don't drive, so you would actually have to pick them up. So her concern is how do they respond to an elderly call who lives alone, who doesn't drive, who believes they may have been exposed at some point, and get them tested without exposing themselves?
Well, first of all, we do have testing available for all symptomatic people. And so we're talking about those symptoms that are associated with COVID-19, the cough, the shortness of breath, fever, and so we do want all of these individuals to be tested. And any individual out there who's watching this, if you have questions about whether you should be tested and how you would go about that, you can call 211, and 211 will answer those questions. Specifically, with respect to, and it was a little hard for me to hear you, these are elderly people who may live by themselves, and they're not going to be able to drive themselves. Yeah.
Tell them that they may have been exposed at some point. And so the question that First Lady Riley has is, how do you actually get them to the testing without exposing themselves? That was the first time I've had that question. So
So it remains the case that if you think you were exposed, you need to treat yourself as if you have been exposed, and you need to quarantine for 14 days. Now, if you develop symptoms, that's when you need to be tested, because it remains the case that the test is not reliable for people who don't yet have symptoms. And so it could give you a false negative when in fact you have it, but you don't, you're going to think you don't, and you're going to continue, you're going to take yourself out of isolation, out of quarantine, and start interacting with people. But if you become symptomatic, then you need to be tested. So if you make contact, quarantine. If you develop symptoms, then you need to be tested, and you can call 211 for questions. And that, Doctor, you have some. It's time for Dr. B to earn his keep, anyway.
Yeah, no, just to echo what the governor was saying. I mean, I think importantly, people are encouraged to reach out to their primary care providers as well, if they're well enough to stay at home and seek that kind of counsel. Anybody who's feeling severely ill should be contacting 911, because obviously we want to get them medical attention. Somebody needs to know when they call 911, share their symptoms as we'd expect them to, just so that those first responders who are coming know to be taking the right protective measures for themselves. But as the governor said, 211 can help connect people to local primary care providers as well. If they don't have one already, there's a network of federally qualified health centers throughout the state, and they are doing testing in addition.
Another pastor on the group wants to know funerals. They're having trouble in some of the smaller parishes because they don't know who should be enforcing the 10-person. They don't know who should be enforcing the 10-person rule at funerals. They're traveling into the small parishes for funerals, and there's no one enforcing. Like there's one small parish where the sheriff said that he will not enforce it, and they can have as many people as funerals they want, but the pastors are getting there to officiate the funerals and being in a room with a whole lot of people.
Yeah, so this is a part of the orders that's hard for anybody to follow. We understand there's no time when you need to be near other people more than when somebody that you loved has passed. However, it can be a compounded difficult time if we get together in a small room, especially more than 10 people. And so I would, to echo again what the governor said previously, hope that we don't have to rely on enforcement, especially at a time like that, but ask people to self-police, ask people to be mindful of the 10-person limit. It's not because that's not a show of your devotion and love to that person, but it's about keeping everybody else healthy. And most importantly, unfortunately, if you're in one of those high-risk groups, if you're over the age of 65, if you're somebody who has underlying comorbidities or underlying conditions like high blood pressure, diabetes, especially if they're hard to control, you really need to be taking steps to not expose yourselves to people. And so we're asking funeral directors, we're asking churches to be creative in the way that we can stay connected at these times, to use Facebook Live or FaceTime or any kind of virtual connection device like that to let people to come together without having to physically be together.
But let your pastor friends know that I'm looking to them to help to enforce this as well. These are the kind of orders nobody ever wants to issue. I certainly don't enjoy issuing them. I'm mindful yesterday was Easter Sunday. But quite frankly, there's not a setting more conducive to the spread of this virus than people sitting in close proximity to one another for an hour or 2 hours at a time at a church service. And you typically see people of all age groups and people who are obviously older and more vulnerable and so forth. And so I'm just asking people to comply. We'll get through this, and we'll get back to the time when we can be as close as we are accustomed to being, and we can all get together and not just do the crawfish bowls and so forth, but get back in our worship services as well. Okay, another question, then we're going to be headed back to South Louisiana, I believe. Yes, sir.
Has any update or a decision been made on schools for the rest of the school year?
So I will issue a proclamation. I think tomorrow is the day that we've selected in consultation with Beth Ciano, who is the interim superintendent of education. I don't want to get too far ahead of myself, but the proclamation, and I mentioned this last week. It is my intention now that to announce that school will not resume in the sense that students are going to be going to school, going to the school building. Education will continue. The school year continues, but they're not going to be going back onto the campuses. And so the distance learning and the other things that have been implemented in order to try to educate our children, those things will continue. And you're going to have a lot more information coming from the school districts locally about what that's going to look like. But it's, the school, around the 20th of May is the last day that you would typically have school anyway. And it's just not going to work by the time this is over. And by the way, we don't know what happens after April the 30th anyway. But it's just not going to be feasible to resume the operation of our schools this academic year. So there'll be more information forthcoming tomorrow from me, and then you're going to hear from the Department of Education and your local school districts as to what that's going to look like here in Ouachita Parish and elsewhere around the state of Louisiana. So, look, I want to thank y'all for coming out. I want to thank everybody again for your social distancing out there and wearing a mask in particular. Ask everybody to continue to be patient. Let's follow the stay-at-home order. Let's make sure that we're practicing social distancing and good hygiene. And then let's continue to lift one another up in prayer. And as tough as it is right now, remember, start with a prayer of thanksgiving and be thankful, as I am, that the tornadoes did not cause more injury and didn't cause a single death in the state of Louisiana. And then let's lift one another in prayer as it relates to COVID-19 as well. Thank you all so much. And thank you for being here today.
Governor John Bill Edwards there amid a duo of emergency response efforts across Louisiana, namely in North Louisiana. Yesterday, we had those weather events, severe storm damage in Monroe and around Monroe. That's why the governor had his change of venue today. Normally, of course, he's at the governor's emergency preparedness headquarters here in Baton Rouge. Looks like he's going to be heading back down there after all of this is done today. So, again, to reiterate, in the severe weather category, no severe injuries and no fatalities. The governor stressing that piece of good news amid what is also a piece of emergency response efforts here on the coronavirus pandemic, saying pretty big developments here in terms of in-person schooling, suggesting that would not resume as we know it this school year, that for the most part, education will continue online and through remote learning, at least through the end of May. The governor also announcing he will be launching an economic resiliency task force later this week to address the economic concerns as far as the response efforts here statewide, the weight and the strain it's posed on businesses, an effort to kind of alleviate some of those concerns and bring business back as soon as it feasibly can. That's the goal of that task force there. But another piece of good news here, 124 new healthcare professionals graduating today from LSU Shreveport, set to start their careers as early as May the 1st, all because of the lifting of some licensing requirements. Of course, that'll be a big help to the hospitals and facilities as we move forward here. But we're going to take you back to regular programming here, very latest at 5 o'clock on NBC Local 33 and 5:30 on Fox 44. Until then, I'm Harrison Golden. Good day.